My name is Peju Raji. I'm a consultant psychiatrist for adults with intellectual disabilities and associate clinical director for the Neurodevelopmental Disorders Services in the Southwest London Trust. I went to medical school in Nigeria and qualified over 30 years ago. I started higher training in Nigeria and was about 3 years into it when I came to this country. And I trained on the St. George's rotation, starting from the beginning all over again. I have been a consultant psychiatrist for over 20 years now, and I started college roles in 2004 when I was regional representative for the Faculty of Learning Disabilities, as it was known then. And a few years later, I became the deputy regional advisor in 2007. And in 2008, I became the regional advisor for all of psychiatry in Southwest London. During that time, I was also a member of the board of the School of Psychiatry at the Deanery, as it was known then, now the HEE. And I was also STC chair for general adult and old age psychiatry. In 2010, I became the first female Black chair of the London division. And over the 4 year term, I completed that in 2014. And I also got the Fellow of the Royal College of Psychiatrists in 2014. The past 12 months have been challenging for everybody. In one way or another, when you think about it, the pandemic, apart from catching people unawares, presented challenges and changes like never before seen in the lifetime of most of us. The rug of predictability and certainty was pulled without warning, not least the impact of the loss of social support and social structures that we had all come to depend on. As a mental health professional, I saw the impact displayed in many different ways. Anxiety being the most common response that people had to the pandemic and the changes in life. I was fortunate to have family around me, and we discovered good things and new ways and rejuvenated old ways of spending time together that was restorative. At the time I entered psychiatry over 30 years ago, it was not the done thing. I was in fourth year medical school. It was during the psychiatry firm I discovered that mental illness was treatable and it had good outcomes. I discovered that, people had been studying mental health and mental illness for years and were making advances that meant that people could regain their lives and livelihoods. Before that, I was of the opinion, the age old concept that it was untreatable and it was without recovery. I was fascinated and I fell in love with psychiatry at that time. The more I found out about psychiatry, the more I loved it. When I came to this country in the 90s, the data showing disproportionate representation of Black and minority ethnicities in detention became apparent to me. People in hospital were more detained than informal. Thankfully, there was then developments in delivering racial equality or delivering race equality, which sought to address this. I am a member of a Black majority church, and at that time I witnessed how many people would not access mental health services willingly well before crisis point because of a commonly held belief that the system was biased against them. In a bid to challenge inequality, a group of us mental health practitioners in church at that time, myself, a mental health nurse, psychotherapist, psychologist, we came together and set up a support group in church. Some of us from that group then went on to set up a voluntary organization in South London. We were helping people who were marginalized, who didn't understand how the mental health system worked. We're helping them to navigate the system. We're helping them to demystify and destigmatize the use of mental health services. And it was heartening to see that they developed greater confidence in using mental health services. We helped them to understand the structures of mental health services and how to have better experience of it. People often don't realize that as professionals in mental health from Black and minority ethnic background, we ourselves face stigma in our sort of communities and in our social context. It is heartening to see that the race issues in healthcare is being addressed on many levels. It is heartening that it is being discussed. Policies are being formulated, old ones are being reawakened. However, I must add that the recent publication of the Race Commission does not do justice to the subject, as it really did not address the issue as comprehensively as it could have. It is really heartening, though, very encouraging as a member of the Royal College of Psychiatrists, that the current president, in one of his priorities, it is equality and diversity. And he has gone on to appoint two presidential co-leads who are working hard to bring about lasting change in race issues, particularly in mental health. We have the annual Black History Month, which helps to focus the mind. And it is a good thing that every year we're reminded about Black history and issues of Black people. However, should that be necessary, that we should be reminded on an annual basis? The last year has put racism, on the global map. We've got the Black Lives Matter movement, the disproportionate impact of COVID-19 on people from Black and Asian ethnicities has also been quite troubling. So one might ask, has the UK progressed in dealing with racism? Well, it is topical. It is on people's minds. It is being talked about more. And so, looking at it from this perspective, it looks promising. But when you look at the trajectory up to now and the many avenues that have been previously pursued to try and address the issues, I think it is safe to say that only time will tell.